Hi, Dr. Desmond White. This is part 2 on acute hepatitis A. We have talked about how Hep A is transmitted, how they present. Let's talk about how we treat, how we diagnose, how we treat. When we see a person with hepatitis A, the person will not tell me that, Dr. White, I have hepatitis A. They present with various symptoms that I mentioned in the previous video. Basically, the liver inflamed, they feel tired, and the intestine will stop moving, they feel bloated, they are constipated, they feel nausea, they vomit, and they may have a fever because it's an infection. And there are two particular unique symptoms of viral hepatitis, including hepatitis A. One of them is loss of appetite. In fact, many authors, even back in the 1940s, noticed that when patients have acute hepatitis like A, they have a particular symptom called distaste of cigarettes. The thing is, when they have hepatitis A or B, when they have acute hepatitis, they lose appetite so bad they don't even feel like smoking. You and I know that smoking is a very strong addictive problem. It's very difficult to quit smoking. But if you are a smoker during hepatitis A, you may even don't want to smoke. I have seen it in my own eye in my practice of seeing hepatitis A patients. So distaste of cigarettes, severe loss of appetite. The second symptom we have seen is prolonged lethargy. People have reported that patients feel extremely tired for weeks to even months after they recover fully from hepatitis A. And the one last unusual symptom is they may have prolonged jaundice. That means the liver become yellow, the eye become yellow, liver is jaundice, the liver function has no abnormality, even though other markers are getting better. Despite that, they continue to be jaundiced. It takes weeks to months to improve. Jaundice itself is not harmful, it doesn't kill a person nor cause any harm, but it just tells us that there's a liver problem. But I do have a colleague, actually he's a medical doctor, he had acute hepatitis A. After he recovered, he had prolonged jaundice, and that caused a problem because you see my eye white, my conjunctiva are white. Imagine I am a doctor, I work in a clinic, and you as a patient, you see that my eye white yellow, you'll be scared and you will see another doctor. So when you're jaundice, after an acute hepatitis A, jaundice sometimes can last for weeks to months, and that poses more of a social, societal kind of a problem. Very hard for them to go out. When you go out, people look at you and say, hey, you're yellow. You are a doctor, you're accountant, you're a lawyer, you're a judge. People say, hey, you're yellow, are you okay, doctor or judge? So therefore, that poses a problem, but they will eventually recover. From the medical literature, roughly 5% of the hepatitis A patient may develop acute hepatitis A. I have limited experience. I see maybe one to 5 cases a year is not common. I have not had a patient that developed acute liver failure, and I told my patient that from a limited experience of 30 years, I see several Hep A cases a year. The recovery rate is 100%. They all recover. How do we make a diagnosis? We first do a liver function test, and they will show jaundice, high bilirubin, and the ALT and AST are often more than 1,000. For this particular patient, the ALT was more than 3,000. The lab doesn't titrate anymore because it was very, very high. And he was a little bit yellow, a little bit jaundice. Normal bilirubin should be up to 24. His is 109, okay? But he's recovering. So when that recognizes acute hepatitis, we'll do a tons of tests to find out whether it's acute hepatitis A or B or C or E or is it other stuff. For him, we did a special test called the anti-HAV IgM, and it was positive. Bingo, it made a diagnosis. So we diagnosed hepatitis A based on history, suggestive of liver problem, the simple test, liver function test that showed liver inflammation, and we will do a whole batch of tests, including anti-HAV IgM. Once the diagnosis is bingo, we got the diagnosis. Even though there's no treatment available to cure the Hep A, it's important to get a diagnosis for a few reasons. Number one, once we know it's hepatitis A, we can stop digging further. In a patient with acute hepatitis of unknown origin, sometimes we go even up to a liver biopsy to find out if they have a seronegative autoimmune hepatitis. So once we get the Hep A, we can stop investigating further. Number two, Hep A had an excellent prognosis profile. We roughly can tell the patient, you're going to be okay because we know this Hep A, and Hep A almost 100% recover. Number three, it is notifiable disease. The moment I find my patient hepatitis A, I'm obliged by law, the Infectious Disease Act, to inform Ministry of Health within 72 hours. I'm going to do so later. So I talk about a part of the symptom, the diagnosis. I will talk a bit about other prevention and treatment in my next video. Dr. Tesman Rai.